Hi everyone, Ron Crider reporting for duty today. It is Saturday. This program is called Numbers because it's all about numbers. Today is December the 12th. It's Saturday, and I'm reporting the numbers from my condo here at Vero Beach at the Indian River Shores at the Victoria Condominium. I'll throw a picture up here so you get a quick look at that. And I need to tell you that 13 days until Christmas, 20 days left in this year, 57 days till the Super Bowl in Tampa. All right, I don't put any commercials on here, so you know that. If you see them, it has nothing to do with me. I also say, don't forget to push the like button. I would appreciate that very much. No school zones today, no school zones tomorrow, so we don't have to worry about that. The flu shot, don't forget to get your flu shot. By the way, I'm wearing my Telluride hat because I'm thinking about going skiing. I'm not actually going skiing. I'm just thinking about going skiing. Colorado's getting a lot of snow. They got a bunch of snow yesterday. They're getting some more snow today. So that's really a good thing for them out there. And looking forward to the day when we can go skiing. But a lot of really good news took place yesterday. The most important news of all yesterday is the Food and Drug Administration authorized Pfizer's COVID-19 vaccine for emergency use on Friday. It was at the end of the day yesterday, clearing the way for millions of highly vulnerable people to begin receiving the vaccine within days. The authorization is a historic turning point in a pandemic that has taken more than 290,000 lives here in the United States. With the decision, the United States becomes the sixth country, in addition to Britain, Bahrain, Canada, Saudi Arabia, and Mexico, to clear that vaccine. Don't know exactly why it took us so long to get it done. Okay, hopefully they were just being extra careful. That's what we would like to think. Pfizer has a deal with the United States government to supply 100 million doses of the vaccine by next March. Under that agreement, the shots will be free to the public. Now, having said that, free to the public doesn't mean it's actually free to us. We don't have to pay. We already paid. We pay in taxes. Our money went to that. The federal government has allocated more than $9 billion to develop and manufacture candidate vaccines. More than $2.5 billion more has been earmarked for vials to store the vaccines, syringes to deliver them, and on efforts to ramp up manufacturing and capacity. It's not known exactly what percentage of the population must be vaccinated to provide enough herd immunity to stop or prevent this outbreak. But researchers believe at least 50 to 70% of the population will be needed to be vaccinated for this protection if we want to make it work. Okay, now, this is something that's really important. For decades, scientists have dreamed about the seemingly endless possibilities of custom-made messenger RNA or mRNA. I don't really understand any of this, and I'm not going to get into the weeds to try to explain it to you because I wouldn't understand it, and you wouldn't understand it probably, except for you extra smart people out there. Bottom line is, the reason they were able to develop this vaccine so quickly is, number one, and you got to hear this, whether you like it or not. We put $9 billion into this system, and this has benefited the whole world. We, the United States government, put $9 billion in it, plus another $2.5 billion. We put all that money in it. We gave them, so-called, a shot in the arm to make this happen. But technology stepped in as well with this RNA and mRNA. This makes it easier, so much easier to develop this vaccine than it ever has been. And by the way, this technology will be able to be used in the future on other vaccines for other things. So this is a little bit like us going to the moon and, in our space shots and all that sort of thing. All the things that were developed as a byproduct of our space program, well, this is going to become a byproduct. This RNA and mRNA technology is going to become a byproduct for our pharmaceutical laboratories. It could probably not have happened without the $9 billion. The other thing to remember is, was there anything good about this pandemic? Well, maybe the good thing about the pandemic was it needed to happen so that we could develop this RNA and mRNA scientific way of developing these drugs so that we can prevent even worse pandemics from coming along in the foreseeable future. That sounds a little like I'm a Pollyanna here, but I am saying I think there might be a little bit of extra good in this. But we are very fortunate. We would not have been able to pull this off and get this vaccine done in 9 months. And regardless of what you think about the President of the United States, he got in there and really pitched hard to make this happen. One thing you got to give him credit for, he is a developer. Doesn't mean he has to develop buildings. He develops things and makes things happen. He is a guy that makes things actually happen. And it takes somebody tough like that to get in. And he takes a lot of flack for it, and it probably has cost him this election. Nonetheless, it's here, and we got to give him a little credit for it, and I, for one, will do so. I'm not trying to be political. I just think it's always important to celebrate somebody who has helped to make something happen. Enough said? Okay, no more politics today. Florida on Friday continued on an upward trend and reported its highest new cases for a single day since July the 25th. Florida reported 11,699 new COVID cases on Friday and another 123 new resident deaths linked to COVID-19. That was yesterday. The state now has reported over 1 million cases since the pandemic began. Those are cases. Those are not deaths. We had 123 deaths yesterday. So yesterday was not a good day. This vaccine cannot get here soon enough. I always say there's light at the end of the tunnel. I've said this so often now, but we just don't know how long the tunnel is. And the reason we don't know how long the tunnel is we don't know how long it's going to take for us to actually get our hands on this vaccine. According to the state, the new reported cases reflect the result of 144,844 COVID-19 tests on Friday for the residents, and that was up from 139,689 the day before. So yesterday it was 144,000 tests, and the previous day it was 139,000. So the tests went up, and obviously as the tests go up, the positivity rate goes up. Okay, nearly 180,000 COVID-19 vaccine doses are slated to come this way, and that's less than what Governor DeSantis had anticipated, but he's working with it, and he's going to push to try to get us some more. DeSantis said Thursday 190,400 Pfizer vaccine doses will be coming to Florida. Of that amount, 81,900 will be sent to CVS and Walgreens and the Florida Department of Health to vaccinate seniors and staff at long-term care facilities, which include nursing homes and assisted living facilities. The Department of Health plans to deploy teams to the long-term care facilities in Broward and Pinellas counties where there have been more than 1,100 deaths, so they're going to zero in on those. The other 97,500 will be sent to Jackson Memorial Hospital in Miami, Advent Health in Orlando, Tampa General Hospital, and the Memorial Healthcare System in Broward County, and University of Florida Health Jacksonville to vaccinate frontline health workers. So there you go. Big day yesterday. Lots of cases, one of the worst days in our state for cases. Cases now, not deaths. We had this huge number of cases, worst since July. That was a big deal. But the biggest deal of all is they finally did approve that vaccine, and it is going to start coming out. I'm going to throw a picture up here because I want you to see, when you see this picture of these great big freezers that they're using in order for to store this vaccine. Because the vaccine that they are using is really has to be kept exceptionally cold, like at minus 94 degrees. It's not good at all. Let me give you the quick weather report today for the Treasure Coast. I put the map up here on the Treasure Coast. The Treasure Coast map, you'll see, is in a little gray area on there, and you'll be able to see exactly what the Treasure Coast is. Treasure Coast weather for today: showers early, then partly cloudy in the afternoon, high 77 degrees. The winds southeast 10 to 15 miles per hour. Chance of rain is going to be about 40% today, and we expect to have a low of it doesn't give us a low today. High is going to be 77, but doesn't give us a low for today. Then tonight, low of 63 degrees, 14% chance of rain tonight. Partly cloudy skies, low 63 degrees tonight. Winds light and variable. We're not going to be in the 50s and the 40s like we were the past couple of days, so it is going to be getting somewhat warmer. And then tomorrow on Sunday, mostly cloudy skies early, then will become partly cloudy later in the day. Chance of rain tomorrow is only about 8%. The high will be 79, and the winds will be south-southeast at 5 to 10 miles per hour. So only about an 8% chance of rain tomorrow. That's really a good thing. We're very happy to hear about that. I also want to put this little business up here about on December the 21st, a bright star, it's called the Christmas star, will appear in the night sky, something that has not happened for about 800 years. So you're going to see this picture up here, and you'll kind of get an idea if you know where Jupiter and Saturn are, and you'll be able to see where that star is. We're going to jump right in, folks, to the numbers today. Remember, I'm going to put the numbers over here, and you will see them. There'll be a time over there when I put them there. As you can see, the clock says right now it's 8:49 on Saturday morning. That's when I put this first section together. However, I don't get the numbers until later in the day. I didn't get the numbers until yesterday. What time was that? I think I said I didn't get the numbers until almost 7 o'clock, 6:45, 7 o'clock last night. It was really terrible. I was really afraid the numbers were going to be even worse than they turned out to be. So you will see when I put the numbers up here, the time that I put the numbers up there, that is not 10 minutes of 9 in the morning here on Saturday morning. That's later on in the day. But at least they're there and they are accurate at that time. Those are the final numbers for the day. Thank you very much for watching. I'll be back with a little bit more after I give you the numbers, so stand by and have a fabulous day. Coming right back. All right, everyone, here we are in the numbers department for Saturday. It is time right now is 2:46. We got these numbers in at 1:45 today. Good news is the numbers are down. They're not terrific, but they're down. They're a whole lot better than yesterday. 71 new deaths reported in the past 24 hours. That's 52 less than yesterday. I can show you yesterday. Yesterday was 123. Today it's 71. As far as positives are concerned, 10,577. That's down by 1,122. Yesterday the positives were 11,699. Kind of a record since July. All right, positivity rate for the entire state of Florida, 7.89. That's always supposed to be under 5, and it is up from yesterday. If it's not green, it's up from yesterday. Miami-Dade, 6 new deaths in the past 24 hours, 2,059. Again, 8.17. That's up from yesterday. That's the positivity rate for Miami-Dade. For Broward County, 2 new deaths to report, 917 new positives. That's 6.86. That's up from yesterday. And in Palm Beach County, no new deaths to report, 556 new positives. Their new positivity rate is 6.31, and that's down from yesterday. Now we'll take a look at Orange County. That's Orlando. 1 new death to report, 759 new positives. That's up from yesterday. Positivity rate up there is 9.36. Let's go up to Brevard County. That's 4 new deaths to report, 187 new positives, and the positivity rate for Brevard County, Melbourne, that's 5.75, and that's down from yesterday. And then St. Lucie County is Fort Pierce. No new deaths to report, 120 new positives, and look at the positivity rate up there, 10.39. Really bad. It's up 10.39, almost double what it's supposed to be. Alrighty, let's take a look at Martin County. Martin County is Stewart. No new deaths to report, 47 new positives. Positivity rate is 6.19. That is down from yesterday. Indian River County, that's where we are. 3 new deaths to report in our county, 48 new positives. 4 of those positives are in zip code 32960. 5 of them are in zip code 32963, and 11 are in zip code 32967. The 7-day moving averages for the entire state of Florida for one day is 101.43. Let's move over here and take a look at that. That's down from 104 on Friday and 104 on Thursday, but up from 100 on Wednesday. Alrighty, I don't really like to do this, but I really feel it's necessary to do so. These are the new cases. We just went through the new cases, but these are the 7-day moving averages for the new cases. I just applied that graph line to that. Look at these guys climbing up here. Really bad. Very, very bad. So These are the 7-day moving averages since we started back in March the 12th. I keep saying to you every day, only you and I can prevent or slow down these positives from going up. And that's by staying out of bars, not congregating, distance, space, and wear your mask. All right, let's go down here and take a look at the deaths. Once again, I'm going to apply the 7-day moving averages to the deaths and look at it going up again. Now, we all know, yesterday was a great day. They approved the vaccine, but we're not going to see the vaccine for a while. And as I say, and I've been saying for the past couple of days, there's light at the end of the tunnel, but this is a pretty long tunnel, and we're not going to see these vaccines take effect and come into our area probably until January or February. So we're going to have to live with them through them. So please, 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 distance, space, wear your masks. This has nothing to do with the governor. It has nothing to do with the president. Please, you got to understand it. Stop blaming everybody except yourself. You are the ones that are responsible for this. We are the ones that are responsible for this going up. Because if we weren't going out and we weren't pretending that everything is back to normal, which it certainly is not, this would not be happening, and these numbers would not be going up. Hey, look at these positivity numbers. Look at these numbers rising. This is all because everybody is going out and thinking that everything is normal. It's the holiday time. It's the season to be jolly. And guess what? It's also the season to get sick. Alrighty, folks, here we are in the states of the United States. I would like to give you the numbers for today, but I can't, and the reason I can't is if you scroll down here, you'll see that we don't know what California, Texas, Georgia, all these states down here have not reported yet. So it's not really a good idea to give you the numbers for today. So I'm going to give you the numbers for the last 48 hours ago. Texas, 232 in first place or worst place. Pennsylvania, 227 in second place. Illinois in third place with 222. California in fourth place with 216. Kansas in fifth place with 131. Ohio in sixth place with 128. Florida, this was 48 hours ago, in seventh place with 123. New York in eighth place with 95. Minnesota in ninth place with 94. Arizona was in 10th place with 91. We'll go down here a little bit further to Colorado, was in 12th place with 87. It's hard to believe that Colorado had 87 with a population of less than 6 million people. Iowa has 77 in 13th place. Indiana's in 14th place with 70. Michigan is in 15th place with 65. Look at Jersey. Jersey's in 59th place, number 16. Our neighbor, Georgia, 17th place with 56. We'll go down a little bit further to Maryland. Here's Maryland for our friend up there. That's Julie up in Maryland. Look at the numbers for Maryland. In 20th place with 52. 52 deaths in the last 48 hours. Massachusetts in 21st place with 48. Wisconsin in 22nd place with 47. We'll go down just a teeny bit further to Missouri. Missouri in 27th place with 42. Connecticut is going to be in 30th place with 36. We'll go down to Montana. Montana is in 35th place with 24. Kentucky in 37th place with 22. Wyoming, look at this. Wyoming has less than 600,000 people. They're in 38th place with 22. We'll go down a little bit further we get to Nebraska in 42nd place with 14. Rhode Island for Jay Grutman in 43rd place with 11. Utah in 44th place with 9. 9 deaths in Utah. New Hampshire in 45th place with 5. Maine in 46th place with 4. Vermont 47th place with 4. We'll go down just a teeny bit further, and that's it. So those are the numbers for the United States 48 hours ago. Not 24, but 48 hours ago. All right, here we go. These are the really terrible numbers. These are what we refer to as the global numbers. Now, if you look over here, you see all these red little dots. These are all little cities, and the bigger the dots, the worse they are. All righty, folks, so let's take a look now at the global numbers. USA cases, 15,966,496. Those are the number of positive cases since we started in the United States. 15,966,496. Deaths in the United States, 296,795. Almost 300,000 people have passed away here in the United States since March when we started this. Now, this is the worst number of all. These are the global cases. 71,430,885. Those are the number of people that have gotten COVID-19 since we started doing this. Those are called the global cases. 71,430,885. Global deaths, 1,600,995. Those are the number of people who passed away in the entire world since March when we started this pandemic. Alrighty, folks, those are the numbers for today. We had so many other things to report because yesterday was a good day from the standpoint that the new vaccine was approved. It's going to be distributed pretty soon. We're going to be seeing it. It'll probably start showing up here tomorrow, Sunday, Monday, and it will be going obviously to the most important places first, like healthcare facilities and all that sort of thing. We personally are not going to see this until sometime in January or February from our standpoint. But at least it's going to begin and it's going to start working, and we're going to see exactly what's happening. So again, thank you very much for watching this video. I do appreciate it, and see you back here again on Sunday. Maybe Sunday we'll have some time for some shout outs. Have a really great and blessed Saturday. Ron Crider signing off.